All right, Medicare annual enrollment ends this Sunday at midnight, and if you haven't taken action yet, the clock is officially ticking. Now is the time to get clear on your options because the right plan can make a major difference in your health and in your wallet. Joining us from Verda Health Plan of Texas are Dorothy Chan and Jonathan Lemus. Good morning.
Good morning.
All right, let me make a prediction. Sunday, 11:59. Hello, I'm calling to get some clarification on. Well, it's too late by then, right? And that we warned people like in October. The holidays will get in the way, and this will slip away from you. The other thing is you always get is Medicare versus Medicaid. This is not Medicaid.
Correct. So Medicare is a federal program that offers for people who is 65 and over, and also certain disability. They also qualify if they are under 65.
Yeah, and it's not one size fits all. Even if it was a fit for you last year, may not mean it's a fit for you this year. Things change. That's why you ask people to at least review.
Absolutely. So everyone condition could change between year. So like we always encourage our members and also Medicare beneficiary to take a look, to do assessment, new medication comes up and new condition come up.
Yeah, is your doctor still practicing?
Absolutely.
Even things like that. All right, Verda Health Plan of Texas, what makes you all different? There are several specific things.
We offer a lot of benefits that you may not find on other carriers. We offer grocery assistance, utility assistance, gym memberships, and we also have a member resource center that's here local. It's like a customer service for someone who they can just go up to the office, get the information that they need, so they don't have to wait on the line.
Yeah, and you found that there are several people who are kind of falling between the cracks, who were not getting the help that they needed, and so you help underserved ethnic communities in particular as well. So what are those qualifications?
We find that it's very important to start in the communities that can use these benefits. Now we service the service areas Harris County, Fort Bend, Montgomery County, and we recently expanded into Dallas as well for Dallas County and Collin County. So as long as they have Medicare A and B and live in the service area, to may qualify for the benefits, I'd recommend them give us a call.
Yeah, and you talked about some of those benefits. I mean, like when you're looking at zero copay, but the primary care physician is so important, right? That's where a lot of things start. But the inpatient hospitalization and urgent care, the lab services and routine x-rays, all those things that we don't think about until we're faced with needing them. And the tier 1 and 2 prescription drugs, which including insulin, because that was a big deal recently.
Exactly right. Yeah, $0 copay for tier 1, tier 2, and for tier 6 on our prescription drug plan.
Oh, wow. Okay. Extra benefits in plans include, up to 3,240 annual allowance, depending on the plan?
Yeah, and that's available on a flex card. So they'll have the flex card where they'll be able to use those additional benefits that we mentioned, and that all comes included with the plan.
Yeah, all right. So some of those extra benefits you talk about, you can fill in for caretakers, which we hear so much about. Silver and fitness membership.
Yeah, they get the gym memberships. They can also get a Fitbit to be able to count their steps and monitor their heart rate as they're exercising if they need to. Healthy lifestyle and better quality of life.
Yeah,
that's
transportation, gas and utility, and these are those things that help so many people stay in their home and age in place, if you will, because it is so expensive to do it out of it, right?
Right.
Okay. The max out of pocket, $999.
It gives a lot of peace. That's the maximum that they'll pay in a year, and after that, they won't have any more medical expense for the rest of the year.
Yeah, that's amazing, right?
Yeah.
I just had a friend of mine call me this morning, and she goes, "This Medicare thing is crazy. Mine just went up," and I'm like, "Okay, I'll tell you who to call," right? Okay. And again, what you all pay attention to is Houston's diversity, and so there are just different nuances and different needs among different communities.
Yeah, I mean, we are focused in Pan-Asian, Hispanic, people who speak a second language. Given a firsthand, myself speak a second language, trying to navigate Medicare is pretty.
Well, trying to do it, period, is hard, right? It's nuts.
Complicated.
And with that said, you all go through training every year on this, or throughout the year on this, right?
That's right.
Yes. What's probably the biggest change?
So I would say every year, there are different changes from the government perspective. So again, we highly encourage you to reach us and
let you navigate through that.
That's right.
But the sooner the better, because time is running out. The last thing you want to do is be on hold because you're like, seriously, you're like, okay, ma'am, it is 11:59, right? So,
absolutely.
And again, the thought is, okay, I didn't get to it, so let me just forget about it. Don't forget about it. There's still a little bit of time left. But there's other things that you all do, as you mentioned. You just offer things that others might not think about. And it's so important for seniors to get social. We saw a lot of this during COVID when we had lockdowns. It was hard enough for a lot of folks, but especially seniors. And so it really impacts your mental health and the whole bit. You encourage people to get out and be social, and you encourage them to do things that really impacts their health.
Yeah, we offer activities at our member resource center just to keep them social. And we also offer senior resources as well. We'll have like people from Medicaid come out and be able to give information, healthy, how to cook healthy, fall prevention, and they also have like painting, Tai Chi classes, things that are not so common, but it's a great way for them to be social.
Now. Can I come now? Right? Yeah. I mean, my gosh. Okay, your birthday celebrations, dancing class, and you can bring a +1. Can I be somebody's +1? All right. But again, an important thing is to not do nothing. Don't just auto enroll.
Absolutely. So again, we highly encourage you to give us a call so that you know to see if your current plan is still intact for you.
Yeah. All right. Thank you very much. I know you're going to be busy. It's kind of like, like April 15th for accountants, right? Yeah, we're busy. All right. Again, Medicare open enrollment ends this Sunday at midnight. Verda Health Plan of Texas has multilingual representatives ready to take your call and walk you through the process to get you enrolled. Remember, they offer $0 copay for a primary care physician, specialist, inpatient hospitalization, urgent care, and so much more. You can enroll by calling this number right there on your screen, 877-419-2730. Again, that number to call is 877-419-2730, or visit them online at verdahptx.com. And remember, I will be your +1 at the dancing classes, painting classes. Do you have like some wine sipping classes?